Regular. Regular menstrual cycle is one of the signs that you are very fertile as a woman. If your menstrual cycle comes round the clock at the same time or at the same number of days, that is to say that you have a healthy ovulation and fertility. Irregular menstrual cycle can suggest to hormonal imbalances or other underlying health issues that can affect your fertility. In this table, it is showing the cycle length, the most fertile day, and the day you start testing with your strip. If you have a 25-day cycle, subtract it by 14 days. The day of your ovulation is the 11th day. This 14th day is the expected day of ovulation in every cycle. So start testing your strips at day 7. Do it for other number of cycles. Then the second one is basal body temperature. When you record your body temperature before ovulation, it will not be the same number when you are having your ovulation. So before you use this method, you have used this method for at least up to 6 months before you can use it to pinpoint your ovulation. Do not find this method very easy because you have to take your time. So in this diagram, you can see the normal body temperature she was having was 35.5. Then before her ovulation, she now has 37.5. Then also in a other situation where your temperature can rise above normal, your normal temperature is during pregnancy. Apart from when you are sick, you are running fever, once you are okay, your body is okay, the only way you have a rise in body temperature is in pregnancy and in ovulation. One is cervical mucus changes. Once you are in your ovulation, that your discharge will become thin, clear and stretchy, resembling a egg white. This can happen around your ovulation. Once you start seeing this type of discharge, you will know that you are in your ovulation. So this fertile cervical mucus, what it really does, it helps the sperm to swim towards the egg. As you can see in this diagram, the first one is sticky and scanty, is not fertile. That one you see that is thick and lotion-like like this is not fertile. But what is wet and watery and it resembles a white and is stretchy, that is your ovulation. So why this is stretchy? Because it can help the sperm to swim faster to the egg rather than other discharges. The next one is ovulation pain. Some women experience mild pain, abdominal discomfort around the time of their ovulation. So these things can help them to predict their ovulation timing. I have discussed with most women and I've seen that most of them say that during the time of my ovulation, I will experience pain on the both side of my lower abdomen or on the one side of my abdominal area. Likewise, you can also have this pain if you have ovarian cyst and other reproductive organ issues. So your reproductive organ is located below your panties. That is where it is located. So any pain around that area suggests that something is affecting your reproductive organ. Why some women use it to pinpoint their ovulation, this can also serve as a point of diagnosis of some certain illness. The next one is hormonal changes. Hormonal fluctuation, particularly the estrogen and the progesterone, regulate the menstrual cycle. So the hormone that is responsible for regulating your menstrual cycle is the estrogen and the progesterone. So which if there is any point in time that there is a frustration, maybe one is lower and one is higher, it can affect your menstrual cycle. So you can use strip to detect this in your urine. Okay, this is a person that is having 28 days regular cycle. She started testing for her ovulation on day 12. The first thing that she did, she didn't see any other line except one bold line. Then on the 13th day, she started seeing fainty line. That is the time these hormones are starting to appear in your blood. Then on 14th day, she still saw it faint. 15 up to the 16th day where she had bold. Then libido and sexual desire. This is the one of the things that will make you to know that yes, you are fertile. Having urge for sex, it comes around your ovulation. So this is a way that nature encourages conception. So heightened sexual desire during this fertile window can indicate your prime time for conception. So women that are trying to conceive use this time to get what they want. So go ahead and do that your wonguru wonguru. So these times you feel this urge is the time to check the bed. So if you are trying to conceive, this is the best time to conceive. That time you notice an increased heightened libido. So enjoy and use that to your maximum and effectively. So this is for men. Your sperm health. For men, factors that can determine whether you are fertile is your sperm motility, your sperm count, and the shape of your sperm. So, for you to influence this positively, you have to ensure that you are having a healthy choices, like such as your diet, you regularly exercise and avoid toxins. Where you can get these toxins is through smoking and excessive drinking of alcohol. Medical tests can help you to identify whether you are fertile or not, such as hormonal profile we give to women trying to conceive or women experiencing hormonal imbalance to know the actual hormone that is imbalanced in their blood, whether it's progesterone or estrogen or prolactin, whichever one that is responsible for fertility will check it through a blood test. Specimen analysis for men to evacuate their sperm. Another one is age and lifestyle factors. So age can also play a role in your fertility. Women have high fertility chances in their 20s than in their 30s. As you grow older from above 35, your chances of conceiving start to diminish and your chances of complication then increases. So lifestyle factors like diet, exercise and stress can affect you. So encourage you to always consult your doctor and always work with your gynecologist. At least a woman should visit her gynae at least once in a year to have a hormonal profile scans in order to check her reproductive organ. It's not always when you are sick or trying to conceive that you visit the gynae. A lady can also walk up to a gynae.